our next presenter is Samantha Fisher. She's currently a lecturer in the Health Science Department at New York City College of Technology. And prior to joining City Tech, Sam also worked as a senior data analyst at Boston College's Global Observatory on Pollution and Health. And her research focuses on the relationship between pollution and pollution-related disease, both in the United States and globally. And she is currently also a PhD student at CUNY Graduate School of Public Health and Health Policy in the Department of Environmental, Occupational, and Geospatial Health Sciences. So Sam, it's all yours.
Cool. Thank you so much. Let me make sure I have the tracking working. Okay. All right. Awesome. Well, thank you all so much for having me. I'm really excited to be here. And I'll try to make this quick as you know we're running out of time. So the title of my talk today and my project is Innovative Approaches to Quantifying Occupational Quaternary Ammonium Compound Exposure in Pregnant Women from Infant Meconium. All right, so just a little bit of background. Quaternary ammonium compounds are a class of chemicals that are commonly used in more than 200 disinfectant cleaning products. They're found in many everyday cleaning products such as dishwashing liquids, hand soaps, window cleaners, things labeled as all-purpose cleaners as well. Disinfectant sprays, you name it. And so this makes population exposure to these chemicals a growing area of concern. These chemicals were first recognized in the early 1900s as having, antibacterial properties, and they're increasingly being used as disinfectants and surface agents, throughout a period of time that followed that. These are preferred over more traditional cleaning agents such as bleach and alcohol because they're known to be both an effective disinfectant in addition to being a little bit less corrosive than other substances. So low-wage workers, folks that are janitors, cleaners, home health aides, people that work in restaurants and grocery stores are at a greater risk of being exposed to QACs due to activities associated with their jobs. In 2019, within the New York metropolitan area alone, janitors and cleaners, home health and personal care aides, and maids and house cleaners made up a large proportion of the workforce. Exposure to these chemicals can lead to several adverse health outcomes, such as dermatitis, eye or mucosal membrane damage, GI issues, oral injuries, asthma. In addition, some animal models suggest that exposure to QACs can lead to birth defects, including increased risk of neural tube defects, which were manifested as kind of structural changes in the spinal cord and brain of the embryo in these particular studies. Exposure to these disinfectants also has a negative effect on mouse reproduction in these animal models as well. And so it poses a significant health hazard to those exposed. All right, so there's a pretty urgent need to study if fetuses are exposed to QACs through placental absorption, as well as better understand these routes of exposure, as these chemicals are very widely used in the workplace and the home. There's currently not very many studies or little to no studies exploring the relationship between QAC exposure and fetal health. But again, animal models show that these chemicals can accumulate in tissue, blood, and can cross the blood placental barrier as well through a number of different mechanisms. And so while these chemicals can cause a range of health consequences in adults, newborns are potentially at risk for developmental and other health effects. And so the purpose of our study is to develop an inexpensive and accurate methodology to measure fetal exposure to QACs in meconium. We're using meconium as a biomarker for exposure, and this is a preferred biomarker for this particular study because it represents a measure of in utero exposure over a critical period of brain development. Meconium production begins early in the second trimester of pregnancy, and it's comprised of a complex mixture of several substances as well. It's also non-invasive, so it was really easy for us to gather this data in hospitals. It was a really fun summer. of doing this kind of work. Yeah, so for those of you that don't know, meconium is essentially the first couple poops of a newborn baby. It's this kind of tar substance, which I have a couple pictures, so you have that to look forward to for the future. But in regards to particular aims, we aim to quantify the exposure profile for quacks among newborns delivered in Brooklyn and Manhattan hospitals using meconium samples. And we also wanted to assess how these exposures affect reproductive outcomes like low birth weight, health, circumference of the head, etc. And then in addition, we wanted to also determine the overall contribution of quacks from occupational sources of, relating to the mother's occupations at the time. Okay, so data collection occurred in 2 public hospitals located in New York City, in the boroughs of Brooklyn and Manhattan. We collected data at Kings County Hospital and then also Metropolitan Hospital. The mother-infant pairs were recruited from these hospitals, and these hospitals were selected because they serve a lower income population typically, and we also wanted to get a diverse range of folks for our study. We ended up collecting 85 meconium samples from the 2 hospitals, from a mixture of both occupationally exposed mothers and non-occupationally exposed mothers. And we did a survey which collected data pertaining to their job, their function, whether they use cleaning supplies on a daily basis, things of that nature. Okay, so we limited our recruitment to mothers of full term, folks who were able to read and speak in both English and Spanish were the languages that we were able to, have recruited in our study. And newborns who already passed their meconium and who were suffering from issues relating to their health were also excluded from the study. We excluded preterm infants as well. So about the recruitment process, while in the postpartum units, the mothers were approached to be recruited in the study. They were given, a consent form, information about the study as well. And then they also completed a really short questionnaire that was aimed to assess both demographic characteristics and then also, information about their occupational exposure. They were then given a kit with a special liner and a diaper and then some collection materials. And then essentially we waited around for the baby to poop. We collected the diaper and then stored it in a -80 degree freezer Celsius. And then basically the questionnaire was utilized in order to kind of gain information about their occupational exposure again. So here's an image of the meconium that we collected. We essentially scraped it into these test tubes and then stored them at -80 degrees. We did our best to kind of contain the samples to not let outside exposure contaminate the samples as well. We used liners on the bench when we were doing the scraping in a room that was isolated as well. And then samples were transported into or in a cooler on a weekly basis from each hospital to our lab at Mount Sinai, who are our partners in this project, and they were then stored there in a -80 degree freezer. Meconium samples were analyzed again at Mount Sinai. This lab that we are working with and have been such great partners throughout this project developed an analytical method that utilized liquid chromatography, mass spectrometry for analysis of the quacks. And then it allowed for them to quantify concentrations of quacks found in household disinfectants. And yes, let's move on. I just see we're running out of time. So here's the targeted quaternary ammonium compounds that were the focus in the analysis. We have some ATMACs, DDACs, BACs as well. And so when we were doing our analysis, these were really the targeted quaternary ammonium compounds that we were trying to quantify. There's a lot more. So here is the chromatogram plot. So just to be clear, we don't have results quite yet. We're waiting on the laboratory analysis. The analysis is very novel, and so it's taking a little bit longer than expected, but we hope to have results soon. But essentially the results will come in the form of these chromatograms that quantitate concentration of quacks in the samples that we're analyzing. So the end result should be basically a concentration that indicates exposure of the mother to and child as well to these chemicals. So here's the chromatogram for both the at-max, BACs, and then DDAC. So in the initial kind of sample analysis that we're embarking on, there have been levels of QACs identified in the meconium, but we're working on really kind of finessing the methodology in order to make sure we provide the most accurate results possible. And then here's some information on the demographic characteristics of our population. Primarily, the population consisted of Black women, followed by Hispanic or Latino women as well, who were enrolled in the study. Here's some information on education, newborn gender, how was the newborn delivered as well. Continuing on, we have some indicators such as gestational age, weight, mother's age, things like that. And then looking at occupational exposure as well, that was assessed from the questionnaire. We have quite a few people in our study sample that were occupationally exposed to cleaning. The way that we identified that is we had a question on the survey that asked them to describe the function of their jobs, and if they listed cleaning as part of their job function, then they were categorized as having an occupational exposure. They also listed the title of their job. Many folks listed janitor, housekeeper, things like that utilize cleaners on a day-to-day basis. So that's pretty much it so far. As I said, we've already collected all the data. It's being analyzed in the lab now. We're hoping in the next few weeks to have the actual concentrations so that we could perform, several statistical analyses to understand the relationship between occupational exposure and, concentrations of QACs that indicate fetal exposure to these chemicals. And so, yes, next steps, waiting on laboratory results, finalize manuscript. And yeah, I want to thank everybody that worked on this project with me, my mentors, all of our fieldwork students, the doctors at the hospitals who are our main points of contact, Dr. Harari, who is here today, who is, finalizing this analysis and creating this analysis as well. And then also the grant for funding this research. But thank you so much.